Are you trying to figure out which Medicare plan is best for you? Is it Plan G? Is it Plan N? Hi, my name is Christopher Westfall. I help people with Medicare. My service doesn't cost a dime. And today I'm going to dive deep into a recent study done by an insurance company called Cigna. You may have heard of them. Going deep into what's going on in the trends with Medicare as it pertains to Plan G, very popular, and Plan N, that we've been a strong advocate of since MACRA passed, a law that took effect January 1, 2020. So let's jump right into the document and I'll tell you more. This document was sent out to all licensed agents with Cigna. It does not say for agent use only. It is available via a link from their public website. So it's not private, confidential information. It's not proprietary in any way. They just put together this white paper. So today, let's jump in and see what's been going on with the different plans. A little bit of history, but I'm going to take you some actionable steps here in a minute that will point out why this is so important. So the executive summary of this research study, and they're not trying to sell you on Cigna, they're not trying to sell you a plan or push one way or the other. They're just identifying what's going on in the market and why, what's behind it. So it says in here that the rise of Plan N is being a more subtle thing. It's coming on since MACRA passed. The addition of Plan G, federal guarantee issue rights, will increase the pricing gap with Plan N. That gap will then widen further through customer selection based on health status. We'll talk about that in just a second. There are two factors impacting the difference between Plan G and Plan N. These two factors, one of which is growing every day, the other one is significant already. We've seen that from the very beginning, are going to have Plan G and Plan N completely split from each other and get even worse. And it says Plan G is expected to continue to attract the majority of customers in the near future. We'll talk about why. But Plan N has long-term appeal for customers looking for better value. That's all I really care about. What is the long-term value for my customers? I don't want somebody calling in here saying they got a 22% rate increase the second year they've been with me as a customer because I did not want to take the time to tell them about a plan that was potentially better for them. What we do in my office, and I've got 13 licensed agents in the other room, we listen first to where you've come from, how often you go to the doctor, what your healthcare needs are, and then make a recommendation and then help you enroll in that plan. And again, our service doesn't cost anything, but listening is the first key to that. Very critically important. So as I go through here, we'll go through the timeline of Medicare. That's not important, but here's the stuff that is. Go down here on the right. The growth in Plan N enrollment was strong during the first several years when it first came out. But with the surge of Plan G popularity, so Plan G is now the easiest thing in the world to explain in the world of Medicare. It pays for everything. Doctor, hospital, routine tests, all those things are paid for if you have original Medicare and a Plan G Medicare supplement. Many agents will tell you that's the best plan to go with. Why? Because it's simple. You don't have to explain anything else. It's just simple. No networks, no prior authorizations, no referrals required. Just go. With that simplicity, though, and the lack of doing any further education, you might be setting yourself up for massive rate increases in the future. Now, why is that important? With Medicare supplements, you can change your plan any time of the year. That's absolutely true, with one caveat. If you're healthy enough to move, or if you live in a state with a guarantee issue rule, like California's got a birthday rule. Missouri has an anniversary rule. New York's open enrollment all year long. If you don't live in one of those states with a special rule, you have to answer health questions to change plans. So riddle me this. A person comes to me at age 65, perfectly healthy, never goes to the doctor, whatever. I'll take one of those Advantage plans or a network plan. No big deal to me. It's a small copay, a maximum out of pocket, limitations on the network. Sure, I'll play by the rules. 3 years later, they find themselves, when the warranty is broken down on their knee, hip, heart, whatever it is, seeking care a lot more than they ever did in the past. That's the way life works. And so when that happens, you may be stuck on a plan if you made the wrong decision, stuck on it for the rest of your Medicare life. That's the key. This bolded part right here, italicized for emphasis. However, the impact of MACRA, that's the law that passed in 2015, which started affecting this right away, really a big impact in 2018. Stick around for the end, I'm going to show you that. And then in 2020, when it took effect, all the predictions of the insurance companies came true. Plan G rates started to go up. Why is that? We'll talk about that. But when MACRA took effect, and that is no more Plan F for people new to Medicare. No more Plan C. You have to have skin in the game, the government says. No more plans that pay all the deductible and everything else. However, the impact of MACRA through Plan G federal guarantee issue rights and customer plan selection behavior changes will shift some of the appeal from G to N. It's not a matter of will or may in the future. We've seen this a dramatic change already. Again, I started saying this in 2015 and it came true. So what are the federal guarantee issue rights? Federal guarantee issue rights, again, only pertain to Plan G now. Means that these companies have to take them. These conditions right here. An employee transitions, their retirement fund ends, they have to go back on their own, get care. How do they do that? They can get guarantee issue Plan G. A Medicare Advantage plan reduces its service area, closes down their area. They got guarantee issue, they can come into Plan G. No health questions asked. Person could be 86 years old, have 500 chronic conditions, and the Plan Gs of the world, every company has to take them. And a Medicare Advantage customer decides to switch back to original Medicare and buy a Medicare supplement during the first 12 months of being on a Medicare Advantage plan, because that very thing I mentioned before. Now they find out that they're a frequent user of healthcare services, and on a Medicare Advantage plan, it's a financial burden, which it is. So once they figure that out, hopefully they're lucky enough to figure that out within the first year and can exercise trial right to go from Advantage back to a Medicare supplement. Guess which guarantee issue plan they get to get? Ooh, Plan G. In these situations, insurers must offer certain Medicare supplement plans without the ability to screen for high-cost chronic health conditions. In other words, they can't medically underwrite the people for Plan G in these certain guarantee issue circumstances. They can, though, underwrite and always will be able to on Plan N. So look over here. The underwritten people don't cost the companies that much. The guarantee issue people that they have no choice but to take, 50 to 100% higher medical claims on those people. So Plan N is only available through open enrollment when you're first ever newly eligible for Part B of Medicare. That's Plan N. So the younger people, typically more healthy, or later in life if you can qualify through medical underwriting. The only two ways you can get Plan N. Plan G, open enrollment, underwriting if you're healthy, or guarantee issue, no questions asked. Now, it only takes a sliver of the people to be guarantee issue to wreck the whole plan. And that's what we're seeing. That's one of two things here happening. So the portion of customers granted these rights is relatively small. So far, there's only been 1 year of guarantee issue for Plan G so far, but the companies, they're getting ready for it. So it's already impacting the rates, but it's going to get a lot worse. Second part here. But the impact on their health plan is significant. The increase in medical claims is a problem because insurers need to cover the additional expense by increasing premiums. Called it 2015. As a matter of fact, Aetna and Mutual of Omaha and others now are pushing people. They're pushing us, the agents, saying, you need to sell Plan G more. Why is that? And it's happening. Talks about medical loss ratios. Therefore, every dollar increase in the average care of costs results in more than $1 increase in the average premium they're going to charge to customers. These insurance companies are in business to make money. They're not going to lose money on somebody. As soon as they start losing money, what do? They jack up the price on everybody else. And again, if you can change plans, because you always in the future, if your crystal ball tells you, you're always going to be healthy, it's never going to be a problem, then by all means go for the easy plan. But there's more to it than just that. You have to have the ability to move over to a new plan. And look what else is happening though. Oh, we'll talk about that in a second. The impact of federal guarantee issue rights on premium can be generalized by Pareto's principle, the 80-20 rule. A small increase in the number of high-cost customers in a plan can cause a large increase in the premium charged to all customers. Plan G we're talking about. This is where this is going to impact it. As a result of MACRA, Plan G is available to customers with 6 of several federal guarantee issue rights now for the first time. We saw it coming. This will increase the portion of high-cost customers and place more and more pressure, not just more pressure, more and more pressure on insurers to raise premiums on Plan G. In 2020, the pressure was low. Why? there was only 1 year of newly eligible customers with federal guarantee issue rights. It started January 1, 2020, but the pressure will increase each year as more and more people age into Medicare. This means Plan G premiums will increase faster than those of plans with fewer guarantee issue rights, like Plan N. It's pretty obvious. Look at the graph. 80% of all healthcare service expenditures come from 20% of the customers. Guess where those 20%, the high cost people, are going to be? They're going to be on Plan G now. Used to be able to go on Plan F, and that's why we always said Plan G was a better alternative than Plan F. When the burden then for guarantee issue shifted from F to G in 2020, we started getting everybody we could off of Plan G and over to Plan N, if it's appropriate for you. And we have to ask you those health questions. Here's the second leg of that whole thing. One, guarantee issue. Bad deal, getting worse every year. We can see it. It's predictable. It's coming. It's happening. Here's the second thing, though. Who is buying Plan N? Who is buying Plan G? And how will that affect the future demographics of those plans? It says right here, customers who preferred more comprehensive coverage and no cost sharing in the past purchased Plan F. It's one premium. It covers everything. You can go to the doctor as much as you want. So at that point, before MACRA started, most customers who wanted to have lower premium and some out-of-pocket costs, which is just the deductible of Medicare, around $200, they were purchasing Plan G back in the day. So that decision process changed in 2020. Now, the customers who want the most comprehensive coverage purchase Plan G. Go to the doctor as many times as you want. You hit that one-time Part B of Medicare deductible once per year. Once that's been met at the doctor, there's no other charges. Go to the doctor as much as you want. However, most customers who prefer lower premium and additional cost sharing purchase Plan N. So typically, customers who anticipate frequent physician visits gravitate toward the comprehensive Plan G. If you're going, and this is the same analysis we do, we have to. If you go to the doctor 20 times a year, Plan G is going to save you money right now because Plan N has a small copay. You add up the copays and the low premium and see, is that better than Plan G or not? And that's just a today decision. But we have to look at, this is what I'm advocating for, look at the long-term decision. If, God forbid, something happens and you get a chronic condition, if you have a heart attack, stroke, diabetes, out of control, something like that, that you cannot then move from plan to plan at will. But again, you can change your Medicare supplement plan 365 days a year if you can qualify, and that's what we specialize in. But when that opportunity is gone, you're stuck. The game of Medicare musical chairs is over. You're stuck there. So here's how this affects you. Over time, this purchasing divide, people who go to the doctor a lot on G, people who hardly ever go because they're healthy on N. This is the choice that they make when they're in open enrollment. So if you have the sicker people that go all the time and the healthier people that don't go all the time, choosing which plan based on their health, then by default, Plan N is going to have a healthier pool of people. And the rate increases follow the healthy trend or not, or lack thereof, of the population. So over time, this purchasing divide impacts the healthcare expenses paid by the plan. Higher cost Plan G customers have higher premiums now, and lower cost Plan N customers have lower premium now. The impact is gradual because the selection process based on health status between Plans G and N is limited to newly eligible customers. So again, same thing's happening. People are coming in at 65 and they're going down their different road. Plan N is the road less traveled. Plan G is the majority of the people who want easy, massive amount to healthcare, access to go with no additional cost, paying about 20-25% more every month forever, and the guarantee issue people being sprinkled on top of that. So looking forward, that's what we want to do if you're going to be on Medicare for longer than 1 year. We can expect that at some point, higher Plan G premiums will exceed the additional Plan N copays on Plan N for most customers. For most customers. Higher premiums on Plan G will exceed the additional Plan N physician copays for most customers, regardless of health status. This is going to get bad, folks. The value proposition of Plan N will improve relative to Plan G. It was good, it's getting better, And I don't know how it could be any clearer than that. If you're relatively healthy, you don't go to the doctor a whole lot, you should probably be on Plan N. The impact of MACRA through federal G. So we got guarantee issue people getting dumped into Plan G. God bless them. They've got to have something to go for. And we've helped people get there. But we know long term, if you have a choice, and for as long as you have a choice, this is something you have to look at very carefully with a trained, licensed expert, especially one that doesn't charge you any money. I know of one you can call. We're licensed in all the states, and you don't have to do this stuff on your own. And I encourage you not to. Let me get to the last page down here. Sorry, I know I talk too much. But I just wanted to point out, this is a big deal. This is other people validating with their research, and you can see at the very end of this document the sources that they cite. Here's the conclusion of this research. While the appeal of Plan N is currently overshadowed by the popularity of Plan G, and there's a reason for that, told you I'd get to, here it comes. Current trends, they point to Plan N emerging as the value choice for more customers in the near future. This is a very nice way of saying it. Let me tell you what really happens, because I work with thousands of insurance agents. This is the truth, okay? Here he goes again. Back in the day, there were a lot of agents. The numbers just prove this out. They were selling Plan F out of sheer laziness and simplicity. Just to say, everything's covered. Just get Plan F. That's the one you want. Get Plan F. I know financial advisors that do stocks, bonds, mutual funds, and all that stuff, telling their people, just get Plan F, you're good. Look for the cheapest price, which is also bad advice, the cheapest price, and get that Plan F. Everything's covered. Okay. Why didn't you tell them about the Plan N? Oh, because that takes time to go in. See, Plan N has co-pays sometimes, and sometimes you don't. So when are the co-pays applicable? We have the document from the National Association of Insurance Commissioners who put together Plan N and put it into effect. We educate all of our customers on that. So if Plan N is going to be more and more popular, if Plan G is the only one taking all the guarantee issue people, if Plan N is chosen by the healthy people now, Plan G is chosen by the unhealthy people now, if rate increases are based solely upon the losses of the insurance company, would it not then make sense to make sure that your agent has, the agent that you put your trust and your money and your time and investment in, has shown you Plan N and told you why Plan N's a bad deal? The truth is this: we as agents are paid a commission based on the number of the premium dollars. If I pitch to you only a Plan G and don't go any further than that, and I stop by simply saying Plan G pays for everything, it's so simple, go. Any doctor, any hospital, no referrals, no prior authorizations, no networks. That's all true, but it's only half the story, see? If they listen to you long enough to find out that Plan N may be appropriate, they should really tell you that it's available. Because again, your ability to get it after your first open enrollment onto Medicare is limited by your ability to health qualify in most states. So if you did not get on it when you first started, you may not be able to get it ever again. And by being lazy, the agent also makes more money. Here's an example. In one location, Plan G is $150 per month. Plan N is $110. There's a difference there of $40 per month. Our average commission is around 20% for Medicare Supplement. So would I, as an agent, want to do less work by saying everything's covered? That's a 2-second conversation. And then say the premium is $150. Or to make less money by going into what Plan N is and how it works, and then making a 20% of 110 instead of 20% of 150 every month? You be the judge. Is it driven by sheer laziness and wanting to get off the phone and help somebody else with that same time investment? Or is it making more money by pitching only the simple plan? And it is simple. It's simple that you'll pay more tomorrow for that plan. Way more than you're paying today. So I'll leave you with this, a resource. I have a website that shows the trend, and we did this study in 2018. We were the first ones of any peers that I know, anybody in the industry, saying this is the time to take Plan N before MACRA hits. Because although it was passed in 2015, did not take effect until January 1, 2020. And in that time, the insurance companies were running to the departments of insurance anticipating losses on G due to guarantee issue, and they were filing for rate increases on G already back in 2018. In 2018, we took, I think it was 12 or 18 data points from all the different insurance companies and plotted them. Plan N right next to Plan G. Same company, same state, same everything. And this is before they had any bad experience on G. This was in anticipation of 2020 starting. So look at the research back then. See what I was saying then. Hold me to account. So the savings over time is what I really want to draw your attention to. That's why I think it's urgent that if your health will allow you to move plans, you should strongly consider, if you're on G right now, consider looking at Plan N. If you're on Plan F right now, oh my goodness, you should be getting off of Plan F. In my humble opinion, having dealt with thousands of people from coast to coast, and C, the website's called PlanNMedicare.org. See for yourself the data. PlanNMedicare.org. You'll see one thing. I take this industry very seriously. I study Medicare and Medicare news and trends night and day. My family can attest to that. This is my life and this is my passion. Helping seniors to not get screwed. I'm sorry, that's just basically it. There are so many pitfalls out there. Everything from Joe Namath talking about fake entitlements to get you to give up your original Medicare, to all the plans being pitched by Dr. Phil, all these other celebrities, leaving out all the small print to flash on the screen in an instant that you cannot even pick up on a 60-inch Jumbotron unless you have a microscope out there and you pause everything. Who has the time to do that? And yet our legislature allows these things to happen. There's so much money in the insurance industry pushing people to get the wrong plan for them. So I just encourage you, when you're going to get advice and education from somebody, see if they have your best interest at heart. Here's how you can tell. Do they first listen to you? What's important to you? How often do you go to the doctor? How important is it that you have a restrictive network that you have to be confined within? So along the same lines, do you ever travel or anticipate later in life traveling outside of your home service area? How often do you go to the doctor for the benefit of choosing a Medicare supplement plan? What drugs are you taking that might be important on the decision of your Part D drug plan? These are things that an agent that takes this industry seriously will take the time to listen to you first and ask these questions. Stephen Covey once famously said, "Seek first to understand before seeking to be understood." And how can we prescribe a recommendation as a professional without first listening to each person and seeing what's important to them and then making a recommendation? So if you're on the wrong plan, or you're considering a plan, or you want to know more about plans in your area, please reach out. That resource has our contact information on too. It's PlanNMedicare.org, or you can visit our main website where we have a lot of helpful resources there called SeniorSavingsNetwork.org. And of course, our toll-free number. You can call us 24 hours a day. If we're not here, it'll give you step-by-step guidance on the information we need to help you. You can call it 24 hours a day at 800-729-9590. And please subscribe to this channel. If you know anybody that's on a Plan F still, my gosh, please get this video to them. Plan F is a basket case right now. And we've been saying that since so far back, 2012. Look at my old video in 2012 called PlanGisBetter.com. And Plan G was better until 2015 when they passed MACRA. You can see everything we've been saying is happening, following the trend in front of it actually hurting our clients has come true. We educate our clients every single year on the changes happening with Medicare. We communicate with our clients, we stay in touch with them, and they share our information and we get our business by referrals. So if you're a client of ours already, or you don't want to be, but you know somebody that's on Medicare on a wrong plan that we could potentially help them, our heart in here is the heart of a servant. We just want to provide help and information. And if you want to stay up to date on things happening with Medicare, Make sure and hit the like button below this video, please. It helps us a lot. Hit the like button. Comment below on what you think about what's happening with Medicare supplement plans. I'd love to engage with you in the comment section here, and make sure you're subscribed to our channel. You know, more than 90% of the people who've watched our channel, over 3.5 million views so far, they're not subscribers. They just land here from something that they've been watching or something that they've searched. If you subscribe and hit the notification bell, when things happen with Medicare and I put an update out there, it might really impact you, you'll be first to be notified of it. So please share this information, do me a favor, and if we can help you, please reach out. Don't suffer in silence. That's my biggest thing to our employees and to our clients. If you're going through something, please reach out. We can probably help you. Thanks so much. God bless you. Bye-bye.